Hi, my name's Phil. I like talking about politics, and in this video I would like to discuss some of Hancock's most breathtaking lies as he attempted to avoid the blame for the horrendous failures that Dominic Cummings, for his own purposes of course, highlighted at the end of last month. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So first off the bat, because we could all do with a laugh, one of the things that the experts have been screaming for over a year is proper financial support to help people isolate. It's all right having a testing regime. It's all right saying to people, look, under these circumstances, you need to isolate either because you've got the virus or because you may have. One huge driver of infection rates is people not getting tested or not isolating if they are tested and test positive because they can't afford to be off work. Sure, there are some knobheads who just don't think the rules apply to them, but huge numbers who just couldn't afford to isolate because of our slave-like levels of statutory sick pay in the UK. Hancock said he didn't support more help for people because, I'm not kidding, he didn't want a network of friends gaming the system. Can you believe that? I mean, he'd know a thing or two about a network of friends gaming the system, I suppose. Being serious, maybe this is a genuine concern of his. After all, when he knows how much he is part of a corrupt network fleecing the country, maybe he sees the same behaviour everywhere. Maybe he really does believe that everyone else is just as bent as he is. But whether this is just a comical excuse or his genuine view, coloured by his own lack of moral fibre, it has absolutely devastated our country. Now, before I get onto his lies about the pandemic so far, it's also worth noting that he was asked a whole range of questions, including very up-to-date ones on the ongoing situation, and he confirmed that the Indian variant, now called the Delta variant, in what I'm assuming are attempts to get people to learn the Greek alphabet, which is something I've been trying to get my physics students to do, I'm fully in support of that, now accounts for 91% of all cases in the UK. This, for me, is where real media scrutiny needs to be, and exactly where it won't be. Stop bellyaching about whether we should or should not carry on easing restrictions. Focus on why it's even a question. Why is the question even being asked? The previously dominant variant is very much in decline. Were it not for the new Delta variant, as we're calling it now, there'd be no question that the final layer would be eased. No question at all. This, the decline has been thanks to both the lockdown and the vaccination programme. We are only in this new mess. We have this new question because of a variant that Boris Johnson allowed into the country. And I mean allowed, because this wasn't just incompetence. He was told very clearly what to do to avoid it, and he refused to do it. He also said that the Prime Minister would make an announcement on the decision next week. And Hancock said he didn't want to say anything that might give clues as to what's going to happen. Which again, a critical media would be all over. What Hancock has let slip there is that the decision has already been made. Because if it was still under discussion, nothing he could say would give us any clue. So if the decision has been made, why not announce it earlier to give more people time to prepare? Either way, whatever that decision is. This constant deception in order to pretend they are making carefully considered decisions is really galling. And you could tell from a lot of Hancock's answers, we knew this anyway, we knew they were going to do this a year ago. It's just getting ready to blame the scientists. They want to pretend, look, we looked at the data and we made our careful considerations. And then when the decisions were completely wrong, they get to say, well, we were misdirected. The scientists let us down. Which is absolute nonsense. And it's only possible because the news media don't shine a spotlight on these things. But anyway, on to a few of his lies about the pandemic so far, covering the first wave right through to the vaccine rollout. And here are what I thought were some choice ones that covered a spread. So he was asked, for example, how he could say there was no national shortage of PPE when nurses were wearing bin bags. Because that's what he said. We had no national shortage of PPE. You what, mate? You what? So what Hancock said is he based this statement on the fact that a National Audit Office report said there was no shortage. This is not really the case though, is it, Mr. Hancock? Because the report he refers to doesn't actually say that at all. It says that our systems, and I quote, were overwhelmed. But he kept repeating this line that the report said there was no national shortage. To say there was no national shortage, there weren't half a lot of individual shortages in every hospital and care home in the country. What he will mean by this is, oh, well, we didn't run out of face masks because somewhere in the country there was a face mask. Therefore, we didn't have a national shortage. That's what he means. He means that in some parts, you name a type of PPE, somewhere in the country it existed. But that's not if a hospital doesn't have enough of a particular type of PPE, there is a shortage. If hundreds of hospitals don't have enough of particular types of PPE, there's a national shortage. National shortage doesn't mean not a trace of it to be found anywhere in the country. But anyway, all I will say is I downloaded the report, for which there is a link in the description below. You can see for yourself. You do a check for the word shortage. It comes up 31 times. At no point did it say there was no shortages. Every time you see the word shortage, it's telling you about a PPE shortage. During the period of time he was being questioned about, it also said that confidence in PPE supplies got better later on. But we're talking about in the first wave here. So, I mean, this has been reported as misrepresenting a line in the report. I don't see it as misrepresenting a line in the report. It's just a straight up lie. Just because there was never a point where there was no PPE in the country doesn't mean we didn't have a national shortage. We had horrendous shortages. He also said there was no evidence that PPE shortages led to anyone working in health and social care dying of COVID. This is complete nonsense. First of all, by being clear that he's talking about staff, he is setting the lives of patients as unimportant. He will know that it would be absolutely insane to even try and claim that no patients or care home residents died as a result of PPE shortages. We know that infections spread like wildfire in hospitals and care homes because of a lack of PPE. So what he's saying is that these people don't matter. Oh, I'm only going to talk about staff, not the patients. They don't matter. But I will just point out also that the numbers of NHS frontline staff and care workers and teachers, when it comes to it, who have died from COVID by far outstrips that of the national average in terms of also developing long COVID. It's right up there. And this is because that lack of basic protection, and these are professions where you're in close contact with people from lots of different households. That is absolutely evidence for a link between lack of PPE and deaths. It's not proof. You've not proved a causal link, but I'm guessing the proof would come if we had a genuine public inquiry into this sort of thing, the sort of thing he's currently blocking. And as I say, he used the episode yesterday so that when the inquiry eventually does come, he's setting out his stall for blaming others. But the data links are absolutely evidence. You can't say there's no evidence for a link between lack of PPE amongst health and social care staff and dying, when health and social care staff who had a lack of PPE died in much higher numbers than the general population at the time. He also said he wasn't involved in procurement contracts. A little bit odd that a court said that his department had acted unlawfully in arranging contracts then. Dawn Butler for Labour also asked if he'd been helpful to people applying. He responded that, well, I pass details on every now and then brought up Rachel Reeves, a member of Labour's front bench, who gave him a list of suppliers. Of course, we have already seen the documentary evidence that Hancock did put civil servants under pressure to give contracts to mates. That came up as part of the Good Law Project's judicial review against his department, where civil servant memos and emails detailed the involvement of ministers like Hancock. So that was another straight up lie. He also didn't get off scot-free on the vaccination programme. I mean, yes, it's gone well. Holistically, it's gone well. But the government have still managed to balls up elements of it with their policies. I remember, and I didn't hear this come up. I didn't watch the whole thing, but I didn't hear this come up. I remember in the early days, the government refusing to allow clinics to use doses on their staff if people hadn't turned up for their appointments. Because what was happening, people initially would be given appointments to the elderly, and sometimes those appointments like 100 miles away or more. That is ridiculous. Absolutely ridiculous to expect 80, 90-year-olds to go 100, 200 miles away. So a number of people weren't turning up for appointments. And healthcare staff were saying, well, initially this was the Pfizer vaccine, which had to be stored at like -70, something silly. So it would be chucked in the bin if it wasn't used. And they were saying, well, can we vaccinate our staff with it? Rather than, no, we had to destroy it. The government said, no, you're not doing that. So rather than give it to frontline healthcare staff when people didn't turn up and it was going to go, they'd rather it was binned. And that's what happened. Didn't see that put to him. But it was suggested that Wales had done better because they were giving out doses as soon as they had them, not reserving. So obviously the way this rollout had worked was different in England as Wales, Northern Ireland and Scotland because of devolution. So each of the different individual nations in the UK had their own approach. And Wales has had an excellent rollout, better than England. And Hancock said, well, the reason for this is, we needed a buffer in England to make sure that the second doses were available. Now, just as an isolated case, I could get that mathematically because I had that concern with them rolling out the vaccine to so many people, which is really important. Can you make sure that when it's time for people to have their second dose, they're going to get it in time? So I absolutely get the principle of that. But that principle would also have applied for Wales, but they managed it. So Hancock was trying to suggest, well, they were taking advantage of the safety net of supply from England. So if they ran out because of their silliness, they would just get some from England. But then my query would be, and I didn't hear this query follow up, my query would be, so if you're saying these reserves in England are to make sure we have second doses on time, why does he think Wales would be able to dip into that supply then? Because what you'd be doing is dipping into the English safety net, which is there only just enough to make sure we definitely have the second doses. That doesn't make sense. Unless, of course, he's talking complete bollocks and we had much more in reserve than we needed to due to his crap accountancy skills. And as a little aside, it did make me laugh when the Conservatives, a little ago, it was outside of this thing, it was like a week or two ago, tried to point at Wales as an example of, oh, this is what happens when you allow a Labour government. And don't get me wrong, just as with the English and Scottish governments, they've made missteps that I would argue they should not have done. There are things that all of them collectively have done wrong. But the vaccine rollout, the only thing the UK government is getting COVID credit for, has gone better in Wales than anywhere else in the UK. So, yeah, I'm happy for them to point out that a Labour government gets you better results than a Conservative one. They can stick that on the side of their bus if they want. But there we are. Those are my thoughts on some of these standout questions and responses. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.